This video aims to advocate for parents to have an active role in the prevention of teen pregnancy. Parents, let's move up to ZAP, Zero Adolescent Pregnancy. The United Nations International Children's Emergency Fund reports that worldwide every fifth child is born by an adolescent mother. 80% of these teen pregnancies occur in third world countries like the Philippines. In the Philippines, National Statistics Office has identified that there are about 500 teenagers who give birth every day. There are 24 babies born every hour from an adolescent mother. 1 in every 10 teenagers 15 to 19 years old is already a mother. In November 2020, the Philippine Social Weather Station revealed that 59% of the Filipinos identified teen pregnancy as the most important problem of women today in the Philippines. It is more important than physical violence and unexpected pregnancy, which was voted only by 11% of the population. Even in 2019, the National Economic Development Authority has identified the status of teen pregnancy in the Philippines as a national social emergency. It calls for action from the Philippine Congress to pass a law on teenage pregnancy prevention. Even with the passing of the Reproductive Health Law, RA 10354, mandating the access of women to the methods of contraception, fertility control, sexual education, and maternal care, still 48% of women do not have access to reliable information about sexuality. The University of the Philippines Population Institute projects more than 2 million births in the country in 2021, in which around 200,000 or about 11% will be from the age group of 20 years old and below. Furthermore, UP also predicts a baby boom in 2021 because of the conditions created by the pandemic. Teenage pregnancy affects about 6% of Filipino girls. The Philippines has the second highest teen pregnancy rate in Southeast Asia based on the Save the Children Global Childhood Report 2019. There is a declining trend of teen pregnancies in the world. The Philippines is the only country in Southeast Asia where teen pregnancy is not declining. The proportion of 10 to 19 years olds who has begun childbearing has been going down to other countries, but it is steadily rising in the Philippines. The increase is steeper among the older teens, 18 to 19, but there is a 100% increase among younger teens. Overall, the picture presented in this figure is that the proportion of teenagers who has begun childbearing is higher in 2018 than in the year 2000. Thus, in this measure, we can conclude that indeed more teenagers are getting pregnant or having become mothers in their teens than in the past. Teenagers with elementary level schooling has the highest proportion of teen mothers. The rise in early childbearing is more pronounced among those with high school and college education, where the trend shows a persistent upward climb for each survey round. The upsurge is especially pronounced among those with college education. In the past, pregnancies during early adolescence or under 15 are rare. The average age for menarche in the olden days is 16.5 years compared with the present times when it is 12.5 years. Menarche and early reproductive maturity are experienced in such early age today than in the past. Furthermore, sexual activity is mainly related to marriage. Increased. Today, the first sexual activity is initiated at a much younger age. There is also a low rate of contraceptive use among this age group. Therefore, the probability of pregnancies during teenage increased. There is also a shift in the young people's relationships where formal courtship, including an introduction to parents, are foregone, to favor informal and casual encounters where friends and alcohol is often cited as catalyzing unplanned and unprotected sex. By the end of 2020, the Commission on Population has reported 70,755 families headed by minors. The agency reported that the number will balloon to 133,265 by the end of 2021. According to the Population Commission, on average, around 64,000 minors, or those 18 years old and below, give birth every year. Around 2,250 children belonging to the 10 to 14 age group gave birth in 2018. The Commission of Population clarified that on the advent of 2021, about 50 Filipino children aged 10 to 14 years old give birth every week. The adverse effects of teen pregnancy. Teen pregnancies are seen as a special problem because of adverse health consequences of teen pregnancies were solely attributed to the young maternal age. According to the National Institute of Health, teen mothers are at risk to several physical problems. Pregnancy places them to be at risk of preeclampsia, anemia, contracting STDs or sexually transmitted diseases, premature delivery, and delivering a baby with low birth weight. They are also predisposed to have mental issues since they most likely have undergone mental and physical abuse. They can have problems such as difficulty bonding with the baby, overwhelming fatigue, thinking of harming themselves or the baby, and difficulty of enjoying activities that they once did. They also may be feeling worthless, anxious, or prone to panic attacks. After giving birth, they are also predisposed to depression. Teen mothers have a higher risk of suicidal ideation than their peers who are not mothers. Teens are also most likely to develop post-traumatic stress disorder than any other women. Infant death is high in adolescent births. Babies of teen mothers are weak because they are preterm or having birth weight lower than normal, or even having congenital anomalies. They are most likely to succumb to infection or other neonatal diseases. Teen mothers also have a closely spaced birth, which provided added stress to their bodies that are not yet ready for the physical demands of childbearing. The close birth interval may not be desired of the teen mother, but due to unmet need for contraception. They are one of the underserved segments of the population. Teen mothers are also disadvantaged in terms of caring for themselves and their child's health. Due to lack of financial resources and support, they may neglect their physical health while caring for their babies. They can engage in unprotected sex, and they may have lesser access to healthy foods. Dropping out of school is a major economic consequence of early pregnancy. When a teenager bears a child and consequently marries, she puts herself in the risk of not finishing her education and of limiting her chances of realizing her full potential. Early pregnancy pushes a girl into an adult role while their bodies are not often ready. She is burdened with childcare when she herself is still a child. If she remains unmarried, she will risk social stigma for having an out-of-wedlock pregnancy. Adolescent pregnancy poses a risk to the life of young mothers and her baby. It can also compromise her health, education, and future employment. According to the UP School of Economics, the government loses $34 billion per year due to student dropout. These are the supposed to be income that the student dropout can earn because they are incapacitated by circumstances. The teen mother can be trapped in a cycle of poverty. Since the adolescent parents cannot support the needs of their children, they are putting them into risk of having low birth weight, die in infancy, less prepared for school, heavily relying on publicly funded welfare, more likely to be incarcerated during adolescence, drop out of high school, and more likely to be unemployed as a young adult. In the Philippines, it is perfectly legal for an adult to engage in consensual sex with a preteen. The country's age of sexual consent has been fixed at 12 years old, among the lowest in the world. Now we have to face the reality that our young people are having sex. Let's teach them to do it safely so that they are not going to have an unplanned pregnancy and be trapped in the cycle of poverty. The major cause of teen pregnancy is lack of information about sexuality and reproductive health. Majority of parents believe that kids receive the most information about sex from friends and other identified media sources, citing that adolescents are able to get vicarious information on sex from the internet, peers, and other people. Adolescents themselves reveal that most of the time the information they got are not correct. They identify this as horribly dangerous because the media emphasizes sex as a wonderful experience and it is a cool thing to engage in. Filipino teens must have an access to authoritative information about sex and reproductive health. The common practice in the Philippine society is that discussion about sexuality and sexual health is a taboo. There is a perception that talking about sex is dirty talk and unbecoming of a lady. According to the Catholic Bishops' Conference of the Philippines, the parents have the responsibility to teach their children about sexuality. According to the American College of Pediatricians, the foundational role of parents is to support, nurture, and guide their children. This is a fundamental right of children in the society. The right is directed towards their welfare and protection from different abuses. As parents, how can we protect our children from teenage pregnancy? First of all, we need to educate ourselves. Read books about teenagers. Think back on your own teen years. Remember your struggle with acne or your embarrassment at developing early or late. Expect some mood changes in your typically sunny child and be prepared for more conflict as he or she matures as an individual. Parents who have known what's coming up can cope with it better. And the more you know, the better you can prepare. Start talking about sex and sexuality starting at a very young age. Conversations are often led with a child's question. Child's question must be seen to it that it will be given developmentally appropriate answers. Talk to children across ages. Openly discuss unintended pregnancy. Encourage them to ask questions on these matters. Emphasize the importance of family values. Remind them always about what is acceptable to you as a family. What is the priority goal? What are your expectations of the family? As who they will hang out with or as to who their friends are. Set rules and be strict in implementing them. Establish rules, curfews, or let them know your expectation in terms of behavior. Talk with the child early and more open. Parents need to be clear about their own social values and beliefs. Parents should not tolerate their children to engage in romantic relations whatsoever until they finish college and find a stable job. Strive for a positive relationship with your teen. Have bonding moments to foster trust and confidence among themselves. Inquire about their personal lives during mealtime. Ask them about their experiences for the day. Go to church together, establish in their faith, and lead a righteous life and be God-fearing. Know your teens' friends and their families. Be friends with their friends. Encourage group activities rather than one-on-one dating at an early age. Keep them focused on their dreams. Talk with your teen about their goals for the future. Make sure they are spending ample time in school activities. Encourage high achievable expectations for school performance. Even if they are mostly learning through distance education nowadays, the class is still one of the best avenues to discuss consequences of early pregnancy. Know what your teen is reading, watching, or listening. This will enable you to explain wrong information or to be able to correct misunderstandings. However, do not forget to respect your child's privacy. Impart to your child the sanctity of marriage. This enables them to look forward and to get ready for it, since it is one of the important milestones in their lives. Being a teenager is an amazing time, as well as a hard time. You get the best and the worst as a teen. Let us help our teen get the best of it. Parents, let us strive to be that trusted adult in our teen's life. Let us be able to guide and equip them so they can become productive and useful citizens of the country. You are a parent and you can do much. Let us work together to zero adolescent pregnancy. Move up to ZAP, Zero Adolescent Pregnancy.